All right, looks like we are live on YouTube as well. So let me go ahead and record this. All right, well, thanks for joining me on this Save My Thyroid Q&A call. And pretty much this call is for you. I'm not really presenting anything. I'm just here to answer questions. I've been going live on Facebook on a regular basis, but I realize not everybody is on Facebook. So I'm doing a call right now, and then there's another one that I'll be doing on Zoom and YouTube on Tuesday night at I think it's 8:30 p.m. my time. And just going to give a few quick announcements, and then we're just again going to jump into Q&A. So just hopefully most of you are aware that I have a podcast, and if not, definitely check it out, savemythyroid.com. So the way the podcast works, the solo episodes, and when it's just me presenting, it's just focusing on hyperthyroidism. But then there's guest interviews, and most of the guest interviews will benefit both those with hyperthyroidism as well as those with Hashimoto's. There are exceptions, like this Tuesday, I'm actually interviewing Dr. Rani Banik, who is a board certified ophthalmologist, and we're going to be talking about thyroid eye disease. So that, for the most part, will benefit those with Graves who have thyroid eye disease. There's actually a small percentage of people with Hashimoto's that have thyroid eye disease as well. So I can't say it's exclusive for those with Graves, but anyway, so just keep that in mind when it comes to the podcast. And also the second announcement I want to make is that on Monday, February 14th, I will be starting a 5-day hyperthyroid healing diet challenge. I did this last year around this time, and it was very successful. So yeah, if you didn't participate last year, definitely participate. If you did participate last year, feel free to join again. And registration details are not available, but they will be within the next few days. And that is it. So again, the way, usually what I do with these chats, just to make it fair, is at least initially is to use the chat. So obviously those on YouTube, you have no choice but to use the chat, the comments area. But those on Zoom, what I will say is let's start using the chat, like just put your questions in the chat. And I'm not opposed to like unmuting people and answering questions that way, but I found in the past that I just couldn't get to everybody when I did it that way. And I want to at least try to get to everybody at least once or two. Like I love to get to everyone's questions, and that's we'll see how many questions there are, but I like to get to everybody's questions at least once. So again, feel free, if you have a question, go ahead and put it in the chat. And again, I'll go back and forth between Zoom and YouTube, and that's pretty much it. So and let's see. So far, no questions on YouTube. Actually, feel free to let me know where you're Zooming from as well. I'm in North Carolina. I'm in the Charlotte area. It's actually Matthews, North Carolina, which is right outside of Charlotte. So yeah, feel free to let me know where you're from, whether you're in the United States or outside of the United States. Okay, so first question is Corey. So Corey was just diagnosed with Graves' disease, and she has elevated TSI and TPO antibodies with a TSH of 0.01, but my T3 and T4 are low, are low range normal. Apparently I have subclinical hyperthyroidism. But definitely I've had symptoms such as heart arrhythmia, palpitations. Is it possible to have these symptoms without elevated T3 and T4? It's possible. I mean, most people with Graves, it's not subclinical. So, so it's, I want, many of you know that I dealt with Graves' disease years ago, and my symptoms and my thyroid hormone levels definitely weren't subclinical; they were elevated. But it is possible. I mean, most of the patients I work with are not subclinical, but I have worked with those with subclinical hyperthyroidism, and it's not uncommon for for people with subclinical hyperthyroidism to also have some of those symptoms. That being said, there could be, excuse me, there could be other causes as well, like cortisol surges, for example. But again, it's physiologically, it doesn't make a whole lot of sense because again, it is typically the T3 and T4 that is responsible for the hyperthyroid symptoms. But again, I have seen people with subclinical hyperthyroidism that are having, elevated resting heart rate and also experiencing heart palpitations as well. But either way, what I would say, I mean, if your levels are within the range now, if you go to an endocrinologist, they might possibly recommend antithyroid medication such as methimazole based on the TSH and maybe even based on the symptoms, the combination of the TSH, and or the symptoms. But either way, I mean, well, I would say definitely want to do something for the symptoms. But I was going to say, obviously, Graves is autoimmune, so you definitely want to address that autoimmune component. If a patient sees me with subclinical hyperthyroidism, where again, TSH is low, thyroid hormone levels look good, and let's say they're not taking any medication. I mean, bugleweed is an option. Bugleweed is an herb that lowers thyroid hormone levels. But again, if thyroid hormone levels are low, I'm sorry, if they're normal or low normal, I might be hesitant and be more likely to recommend something such as motherwort or hawthorn, something that focuses more on the cardiovascular system. All right, so next question was sent to me privately. So I'm not going to read the person's name, but I will read their question. So wondering if you have any experience with people having elevated TPO antibodies post-COVID or post-COVID vaccine. I have a severe reaction to the vaccine and my TPO antibodies were elevated in September, but by December back in normal range. 2 thyroid ultrasounds, which showed how damaged indicative of Hashimoto's. Just curious what this may mean. And I'm in Ontario, Canada. So yeah, I actually battled COVID earlier this year. Yeah, there actually is evidence. Well, I mean, I have, so to answer your question, I have seen patients where where COVID does cause in some cases, it could be if someone doesn't have any past history of Hashimoto's or Graves, it can be a trigger. And there is actually, I haven't seen anything in the literature about Hashimoto's, honestly, about the TPO antibodies, but there are a number of studies showing a connection between COVID and Graves' disease. And, my practice, I have seen that's the catch-22 when it comes to the vaccine or getting COVID. Both of those can trigger autoimmunity or exacerbate autoimmunity in someone who currently has Graves or Hashimoto's. I've also seen a number of people who got the vaccine or got COVID and everything was fine. Like it didn't exacerbate the condition. And again, I just, I have a history of Graves and I just got COVID. I was dealing with COVID for a little bit. And again, thankfully, I still haven't gone to a lab to test, so I can't say 100% I haven't relapsed, but I definitely don't feel hyperthyroid, and so I don't think it caused a relapse in me, but it is possible. Just keep in mind when it comes to viruses, not just COVID, but Epstein-Barr, usually there are other imbalances. So so the virus could act as a trigger, but there are other things that usually you need to focus on, like adrenal stress is huge when it comes to viruses. And so most people need to work on improving their adrenal health, their gut health, reducing their toxic load. So because I'm sure that's a question too. Well, what could you do? Because COVID, kind of comes and goes. But if it once it goes and I still have those elevated TPO antibodies, again, the virus, served as a trigger, but there were other underlying imbalances that also were contributing factors, and that's what I would focus on. All right, let's see. So Layla, greetings from Africa. All right, I can't. I'm not going to attempt to pronounce where in Africa, but thanks for joining us. Okay, Marie says, oh, okay, for volume was low, but now you can hear me. Okay, great. And let's see, and I'll get to see if there's any questions on YouTube shortly. And I'm going to go about 3 o'clock, if I have to, like a few minutes after. I told my younger daughter I'll take her. There's a used bookstore in Charlotte she wants to go to. So I have to take her this afternoon. But so Michael says, how long after starting Armor should I trust not sure. How long after starting Armor should I trust for me level? Oh, I assume, should I test for my levels? When does it start to plateau off? Yeah, I mean, every doctor will be different. I would say, about like if you're just starting Armor, I would say like 4 to 6 weeks after would be a good time to do the first blood test. Like a month, like probably closer to a week. How long does Armor last in the body before it washes out to see what the true baseline? That's a good question. I honestly am not sure how long you would need to be off of Armor, to see like what your levels look like without the Armor. So I'm guessing we could probably like find the answers to that relatively quickly, but like the half-life you would want to look at when it comes to Armor, but let me see if I could quickly. Let's see, half-life. Yeah, so here, drugs.com website says like 4 to 5 weeks. All right, let's see. Can Sjogren's syndrome affect my Hashimoto's? Actually, let me just see. Okay, I'll answer that quickly, and then what I'll try to do is try to get to every, because Marie already, I know you already had a question, and again, I want to get to everybody at least once. But Sjogren's is also autoimmune, and someone with one autoimmune is like Sjogren's syndrome is not necessarily going to directly affect Hashimoto's, but if you have one autoimmune condition, you're more likely to have multiple autoimmune conditions, which because you have Sjogren's and Hashimoto's. But it's not that they necessarily will affect one another, but you could have an overlap in triggers. You could have, if you have 2 different autoimmune conditions, you could have the same trigger affecting both conditions, or you could have multiple triggers. All right, let me. Okay, I'm going to quickly check YouTube, and then we'll go back to Zoom. Okay, it doesn't look like we have any questions on YouTube, so okay, so next question is Walt. So Walt, diagnosed at Hashimoto about 12 years ago, have seen 4 endocrinologists over the years, developed a goiter that has enlarged and deviated my trachea. The surgeon recommended a partial thyroidectomy. Sorry, I lost the question. Okay, surgeon recommended partial thyroidectomy. would appreciate your opinion as to what potential effect the surgery may have on the autoimmune Hashimoto's. Yeah, well, I mean, just so what Hashimoto's, again, Hashimoto's obviously the immune system attacking the thyroid gland. So, I mean, if you have a partial thyroidectomy, you still like if, you still have, you'll still have, half the thyroid gland. And I mean, in most cases, it shouldn't have a big impact on, it shouldn't like, make things better or worse with the, as far as when it comes to Hashimoto's. And yeah, sorry you have to get that thyroid partial thyroidectomy with the large, real large goiter. But yeah, it shouldn't have a huge impact on the. I mean, if you talk about the actual surgery, it's like not the actual partial thyroidectomy, but I don't know if you mean like the effects of the anesthesia and things like that. I mean, I guess there's always a risk, but I've had patients with both Graves, Hashimoto's, had to go, get general anesthesia, and that's, and usually I have not seen an exacerbation. But as far as like the partial thyroidectomy itself, also again, I wouldn't expect that to have a dramatic impact on the Hashimoto's, and again, as you know, Hashimoto's autoimmune, so definitely, even though you get in that partial thyroidectomy, I would still continue to work on trying to address the cause of the problem, trying to, improve the health of the immune system. All right, so let's see. So we haven't answered a question from Layla, who's again in Africa. So and again, if someone has multiple questions, I'm going to try to get to everyone's questions. I can't guarantee that, but Layla, hi, Dr. Eric. I was diagnosed with hyperthyroidism in August. After 2 months of medication, a small dose, I went for a lab test, the number was completely reversed, and I was diagnosed with hypothyroidism. How is this possible? Actually, that's pretty common, even, on a small dose, like if you're on 5 to 10 milligrams of, methimazole, which is a smaller dose, some people that's enough to make them hypo, but usually it's temporary. Usually like once they stop that, let's say if someone's on 10 milligrams of methimazole, they might become hypo after even like a month, let alone 2 months. And then, some doctors will panic and they'll take the person off the medication. And frequently what will happen is they'll become hyper again. Some doctors will just decrease the dose from like 10 milligrams to 5 milligrams. But that's what the anti-thyroid medication does. It actually makes someone hypo. Now, again, I don't know if that's the entire story. Like you said, after 2 months, you went for a lab test and then were completely reversed. So I don't know if they took you off the medication and you remained hypo. I mean, I will say that with hyperthyroidism, another scenario is that people with Graves also can have the antibodies for Hashimoto's. And so, so again, over time, that could cause someone could be hyper, but then, eventually become hypo. But to me, this sounds like a situation where you're on the medication and, the medication made you hypo after a couple of months, but feel free to expand on that. Let's see. Okay, Alice, don't think I've asked. Okay, and yeah, well, like again, some people, if you're new with with Zoom, I mean, you could send it directly to me, and then nobody will see. Like, most people when we do these calls, most people are just putting in the chat, and then yeah, everybody could see it, but I'm reading it out anyway. So I guess that's the purpose of these, like the group call is to get your question answered, but to have others benefit, from the question, and the answer. So again, if someone wants, like, there's a few people that directly message, and that means nobody in Zoom will see your question. But again, I'm going to read it out loud. I just won't read the person's name, but anyway, so I guess either way doesn't make a difference. But But Alice's question just found out that you had hyperthyroidism, got the uptake scan, which showed increased isotope trapping in both lobes, more prominent on the right. No cold nodules, given asymmetry, toxic nodules cannot exclude. What kind of testing can I expect? What results might be possible? So was it increased? So increased uptake typically is associated with Graves, but I guess the question is, did you also get the antibodies? So I mean, definitely anybody, who gets the radioactive iodine uptake scan, you definitely want to still get the antibodies for Graves, the thyroid stimulating immunoglobulins, which is a type of TSH receptor antibody. So assuming you have, I mean, whether someone has Graves or someone has, toxic multinodular goiter, let's say, and here it says toxic nodules cannot be excluded. I mean, the treatments from an endocrinologist standpoint is pretty similar, either methimazole, radioactive iodine, or thyroid surgery, but obviously my goal is to try to address the cause of the problem. If someone were to have like subacute thyroiditis, which it doesn't sound like that, that's more transient and oftentimes viral induced. Actually, COVID, I mentioned how COVID could be a trigger for Graves. In the literature also, COVID has been shown. I wrote an article fall of 2020 where it showed that where the research shows that COVID could also cause subacute thyroiditis, like hyperthyroidism associated with subacute thyroiditis. All right, so this next question is, again, a private question. So I'll read the question, but not the person who asked. So 21-year-old male with Graves, feeling all feelings numbed except for anxiety, levels apparently normal, continues to be hopeful. Next day will be different, but not. He is not depressed. What is this? Okay, so you have Graves. So your thyroid stimulating immunoglobulins, I assume, were positive, but your thyroid, again, another situation where thyroid hormone levels are normal. Now you said apparently normal. So the question is, are they on the higher side? Again, there are some cases with subclinical where someone will be still symptomatic, but just, I wrote an article, and I also have a podcast episode on anxiety. And, there could be numerous causes of anxiety. If someone has Graves, hyperthyroidism causes anxiety, but there could be other factors like, with autoimmunity, most of the immune system cells are in the gut. And again, a lot of anxiety stems from the gut as well, because most of the neurotransmitters are also located in the gut. So again, that's one area to look at. Again, adrenal imbalances could also lead to anxiety, hidden infections, and infections could be a trigger for Graves. Definitely check out savemythyroid.com, click on podcast. And I'm not sure what episode. Trying to find out here if I could. But yeah, definitely check out that episode. Oh, it's. Yeah, I'll actually put it in the chat, the episode on anxiety. Actually, it's episode number 6. All right, so actually sent it to someone specifically. So let me choose everyone in the meeting. Okay, there we go. All right, let me just double check on YouTube and see if there's Anybody on YouTube? Actually, so YouTube, so Julius has a bunch of questions. So again, we'll get to one question, Julius. Like I said, I'm trying to get to everybody at least once. And you're writing from Trinidad. So what's the best way to deal with thyroid eye disease? Person is on carbimazole and his hormone levels are normalized, but no change in bulging eyes. So again, thyroid eye disease is more of an immune system condition. So even if the thyroid hormone levels are normal, you could still have the bulging eyes and other eye symptoms. So definitely check out on Tuesday. I actually do have I do have a podcast episode on thyroid eye disease, but there's one, but I'm going to interview Dr. Ronnie Bannock on just yeah, so episode 8, I'll include that in the chat as well. But this again, this Tuesday, definitely check out this episode. So the number 8, and then Tuesday's episode with thyroid eye disease. But again, immune system. So same thing with Graves. You want to, or same with Graves, Hashimoto's. You want to find, remove triggers, correct underlying imbalances. I mean, there are supplements that can help, like things like selenium, and she mentions a few other supplements, during the episode. But selenium is one of the more well-researched ones. But it really comes down to finding, removing triggers. Just actually today on YouTube, I released Dr. Weston Childs. We spoke about certain supplements as well. But again, as far as thyroid eye disease, check out that podcast episode that I just put in the chat, and then also check out Tuesday when I interview Dr. Ronnie Bannock. All right, so back to Zoom. So Veronica is from Chicago, and her TSI and TPO were negative, did not do an uptake scan. Ultrasound detected one small nodule that is less than 5 millimeters. There was no goiter. I've not had any symptoms. I was diagnosed in early August. I initially did not respond to methimazole, so my dose was increased to 40 milligrams. Once I responded, my TSH started to go up very quickly, and my T3 and T4 were going down very quickly. My TSH is now 40, which is pretty high. I was told to stop methimazole for several days and restart at 10 milligrams. I've not been sick for years, but I was on experimental fertility treatments. I was on a high dose of both ethinyl estradiol and regular estrogen. I also spent a week swimming in the ocean, and a couple of days later, I was diagnosed with hyperthyroidism. And what could be the cause of my hyperthyroidism? Yeah, so your again, now antibodies, most people will test positive, especially with Graves, but they're not perfect. So you might want to do like what's called a serum immunoglobulin G, and you could do that at a regular lab, like a LabCorp Quest Diagnostics. And if that is low, so serum IgG or serum immunoglobulin G, if that is low, then you could have a false negative antibodies. So let's see. So one small nodule and no goiter. So it sounds like it's not toxic multinodule goiter. And it'd be interesting to know like what your levels were, because again, there's, as far as like different types of, well, one thing you might want to test, so there's different, so as far as different causes of hyperthyroidism, so there's Graves is the most common cause. And again, it sounds like it's probably not Graves, but like I said, you might want to test the serum immunoglobulin G. There's toxic multinodule goiter. And again, it sounds like that's not yours, as you don't have a goiter, you only have one small nodule. And then there's subacute thyroiditis, which is a possibility, especially if someone, if someone's only had it for a few months, like 2 to 4 months. And if again, no Graves, no toxic multinodule goiter, so that's a possibility. And subacute thyroiditis, typically viral induced. Again, I do have some articles on my website, naturalendocrinesolutions.com. And so that's a possibility. There's also hashitoxicosis, where someone has Hashimoto's, but they have flares, like hyperthyroid flares, transient periods of hyperthyroidism. So you might want to consider testing the thyroglobulin antibodies, antithyroglobulin antibodies, which are more commonly associated with Hashimoto's. If those are positive, then we might be looking at hashitoxicosis. If that's negative, then I'm thinking maybe subacute thyroiditis. There are also cases of subclinical hyperthyroidism, where that's kind of like really where we don't like, not subclinical Graves, but just subclinical hyperthyroidism, where they don't have Graves, they don't have toxic multinodular goiter, but again, it sounds like you had elevated thyroid hormone levels, or else I would guess they wouldn't have put you on such a high dose of methimazole. So based on what you said, I mean, I'm not 100% sure, but I'm thinking maybe more like subacute thyroiditis. So Walt said, would the autoimmune start attacking the other lobe? So Walt got, again, he's getting the partial thyroidectomy. I mean, it might already, even though you have like the goiter and it's more prominent on one side, it doesn't mean that your immune system isn't already attacking the other side. So, but if for any reason, again, usually it might predominantly, like with Hashimoto's, predominantly like affect one side more than the other. But yeah, to answer your question, if it was predominantly attacking the other side, which was causing the goiter, now that, yeah, that is correct. It could predominantly start attacking the other side, and that's why I was like saying, you definitely want to still do things to focus on the immune system. So again, hopefully you're doing that. And again, I know you've dealt with it, I think you said for 12 years. So you might have worked, I know you've worked with a number of endocrinologists. I don't know if you've worked with any like functional medicine doctors, natural healthcare practitioners. Definitely, if you haven't done so, check out my book, Hashimoto's Triggers. But there's definitely no shortage of practitioners out there that work with Hashimoto's patients. Unfortunately, not as many practitioners that work with hyperthyroidism and Graves. All right, so Penny, I don't think, so Penny and then Sherry, I don't think I've answered questions from either one of you. So, and then Kiki. So those will be the next 3 questions. And then we'll see if there's if we just have repeat questions after that, then I'll go back and try to, again, address as many as I can. But so Penny says, I have Hashimoto's hypothyroidism. Would your 5-day hyperthyroid healing diet be of any help to me? It's also autoimmune condition. Yeah, it's, actually I had I did a Facebook Live yesterday. I did like a Q&A and someone asked me that. And, the answer I had is that probably like 80% of the information will benefit those with Hashimoto's as well. But there are going to be there will be some information more specific to hyperthyroid. Like I can't say that 100% of the information is just going to be on hyperthyroidism and won't benefit Hashimoto's. Definitely, you're right. Like with Graves, Hashimoto's, there is overlap. Again, it's not going to just focus on Graves because there are non-autoimmune hyperthyroid conditions. So if someone has toxic multinodular goiter, for example, they could benefit from the hyperthyroid healing diet. But yeah, if you have Hashimoto's, I mean, it's, obviously it's a free challenge, so you have nothing to lose by tuning in. And if you feel like, after a few days you're not getting value, then, you of course don't have to continue participating. And the way the challenge will work is that every day, so again, 5-day challenge, every day there'll be a pre-recorded video sent to you. So it'll be typically like 10 to 20 minutes long. And then I'll be live pretty much throughout the week, going on Zoom. And yeah, so yeah, I mean, definitely if anybody has Hashimoto's and you want to participate, no problem. Oh, and Sherry. So Sherry was part of my 6-week program that I had in November and misses the 6-week program conversations. Yeah, that was, I mean, the 5-day challenge will be fun, but the longer like challenges and programs, you do build a bigger bonds with people. So good to see you, or good to see your name. Of course, well, actually, maybe you are. I don't know if you're on video, but I'm right now. I just have the chat up, so I'm not seeing anybody on video yet. Right now, I just expanded the chat. But anyway, so Sherry says, I feel like the Graves was directly related to COVID in June. I've not been vaccinated as I'm afraid it will hamper my ongoing recovering from Graves. I check my COVID antibodies periodically and they continue to increase. Would that be due to having COVID and monoclonal antibodies, or am I being exposed to COVID and I don't know it? And how does any of that affect my Graves recovery? That's interesting. Yeah, I'm not sure. I don't have a lot of experience looking at COVID antibodies. I do have a lot of experience looking at Epstein-Barr virus antibodies. And there's controversy with Epstein-Barr, but it does seem that the higher the antibody titers, the more likely that Epstein-Barr is causing problems. And so it very well might be the case with COVID. But as far as are you being exposed to COVID, yeah, I don't think so. I it's one of those things where, it's, I'm guessing, even though, again, what Epstein-Barr, like someone gets Epstein-Barr, they get the symptoms of mononucleosis, and then, usually they don't do any treatments, usually you get it like as a, teenager, young adult. Actually, someone told me the other day that they had it as like a 4-year-old, which is not too common. But anyway, once the mononucleosis is gone, you still have the Epstein-Barr. So with COVID, again, I'm not sure, like viruses are a little bit different, like with bacteria. Like with bacteria, you take whatever antibiotic, or you take a natural antimicrobial, and the goal is to try to get rid of completely the bacteria. With viruses, they can stay in your system. So, and again, I haven't heard about like COVID, like as far as like similar with Epstein-Barr, like, where it like stays and, just where like 5, 10, 15 years down the road, someone would still have like the COVID antibodies, like they would the Epstein-Barr antibody. So that I'm not sure is the case. So yeah, my guess, again, I'm not 100% sure. This is still, this COVID, of course, still kind of new and we're still learning. But my guess is you're not still being exposed to COVID. My guess is you might still have, even though you're not symptomatic, you might still have the virus, in some of your cells. And that's, again, the case with Epstein-Barr. A lot of people have it, but they're not symptomatic. But again, like I said, I'm not 100% sure. Just I've done some research with COVID. I'm actually looking to come out with a podcast episode where I talk about COVID and probably more so hyperthyroidism, because again, maybe I'll do like COVID and thyroid autoimmunity or something like that. But again, I don't think in the research there's anything showing Hashimoto's. But again, I could bring up clinical experience too. But anyway, so be on the lookout for that. And when I do research for that podcast episode, I'll see, if I find anything where COVID is like kind of persisting, like, Epstein-Barr, I'll try to remember to bring that up during that episode. And I'm not sure when the episode will be released. It might be a month or two, just to let you know, because I gotta put it together, like the outline, and then I actually got to record it. So it probably won't be out. My guess is probably not until March at the earliest. But and then so Kiki here says, I just found out that I have osteopenia. My girlfriend told me that she was diagnosed with the same thing and found out that because of Synthroid medication that causes bone loss. So both she and I have stopped taking Synthroid. What hypothyroid med would you recommend that does not cause bone loss? So I actually just did an interview on my podcast and it's also on my, well, she's not a doctor. She's actually a physical therapist. Margie Bissinger, I think her last name. But if you visit, again, it's episode 24, 25, one of the more recent episodes, and it's on bone density, and she actually mentioned thyroid hormone replacements. So it's not just the Synthroid. I mean, if someone, you just got to be careful with the dose. If someone takes too high of a dose of any type of thyroid hormone replacement, it can cause decreased bone density. For those who aren't familiar with osteopenia, it's decreased bone density, and of course the next step is osteoporosis, which nobody wants osteopenia, let alone osteoporosis. But again, I mean, you could try like desiccated thyroid, like Armor, Nature Thyroid, WP Thyroid, NP Thyroid. But if you're taking a higher dose, it can also affect the bone density. So it's not the Synthroid's definitely not my favorite thyroid hormone replacement, but I've had a lot of patients take that. And again, as long as it's, their thyroid hormone levels aren't like super high, and TSH will be, again, as long as they're not hyper, pretty much with elevated thyroid hormone levels, lower, depressed TSH, you should be okay with Synthroid or any other thyroid hormone meds. But if you're looking for something else other than synthetic T4, then I would say desiccated thyroid hormone is something to consider. All right, actually, Nicole, I haven't. Let's see. So Nicole, I don't think I've answered a question. So sometimes I take Levothyroxine right before I sleep. So is working out early in the morning, such as running, and then right after weight training for a couple of hours? Wait, so is working out early in the morning for a couple of hours, fasted, good or bad on your thyroid? So, I mean, as long as you're not doing really, like if you're fast, I mean, if you wake up and, I'm definitely an advocate of intermittent fasting. Just what my patients, I'm cautious, especially, a lot of them have adrenal problems. And so, if you're doing, if you're in a pretty healthy state and you're fasting for a few hours upon awakening, and exercising, it's not necessarily bad on the thyroid. If someone is in a compromised state, their adrenals, are not in a good state of health, and then you're fasting, and then especially if you're doing like high intensity and interval training, things like that, then that could put stress on the thyroid. So it really depends on the person. If someone's in a good state of health, again, taking levothyroxine at night, and then in the morning, maybe wake up whatever, like 7 o'clock, go exercise at like 9 o'clock, so again a few hours fasting, and yeah, so that, I can't say across the board that's bad on thyroid. And so it really depends on the person. And then my partner got the vaccination and 1 or 2 months later got Graves. He doesn't want to take the medication. He might have candida. What should I do? Can one get cancer if not taking medication? I didn't take medication when I dealt with Graves. So, look into bugleweed, look into motherwort. I mean, definitely have him check out my website, savemythyroid.com. And, I have I think it's episodes 2 and 3. I talk about like conventional and natural treatment options, like conventional and natural symptom management options. So if he doesn't want to take the medication, obviously, he'll want the natural symptom management options. I forget if it's number 2 or 3, which episode, but have him listen to that. And I talk about bugleweed, I talk about motherwort, which is what I took. There's lemon balm, there's L-carnitine. All right. I'm forgetting who I answered. There's one from Pauline. I just want to make sure I didn't answer a question from you, because I was about to go back. All right, so Pauline, Hashimoto's diagnosis in 1978 with antibodies 245, ability of antibodies graphable, on meds for 6 years, stabilized my symptoms, had a complete healing. Doctor weaned me off of all medication. 34 years later, blood tests for thyroid were raging. I was very stressed and tired, was put back on 100 micrograms of levothyroxine. Empty stomach when awakening since 2015. My levels all show stable. Is there a way to get off the levothyroxine, and is 100 micrograms a high level of medication? Does prolonged use cause vertigo or other issues? I'm going to my first ever appointment, February 28th, to a functional medicine doctor. What questions or tests should I request at that appointment? I mean, 100 micrograms is a pretty decent dose. I mean, it's you could go higher, but it's definitely not a lower dose. And yeah, and I would speak with the functional medicine doctor about getting off the med. I mean, to answer your question, if you're on 100 micrograms, the higher the dose someone's on, the more difficult it's going to be to get off the medication. But it doesn't mean that you can't. If you just started, that's the good news, is you just started it. But it's all about trying. Like if someone, there's no herbal replacement for thyroid hormone. I will say that. There's natural glandulars. I mean, some people will take things like ashwagandha, which can sometimes stimulate thyroid hormone production, but depending on the cause, usually that's not going to be sufficient. So, but definitely speak with the practitioner. I mean, the functional medicine doctor is going to, hopefully address the cause of the problem. And, I mean, I don't know really the questions, to ask. I mean, just, like, what are you going to do to try to address the cause of the problem, I guess. But, test, there's a, like bunch of blood tests, that you could recommend, thyroid, I mean, it sounds like you had like recent thyroid panel antibodies, but things like vitamin Z, iron panel, B12, things that are come to mind. HSCRP, I recommend. I mean, I like to do adrenal testing, like saliva testing or dried urine testing. Some will do like comprehensive stool panel, but I can't say everybody, needs to do that test. But yeah, if it sounds, so if you have Hashimoto's, and again, well, when's your February 28th, check out my book, again, not to plug my book, but Hashimoto's Triggers. Again, this is a detailed question. And if you want detailed answers, my book is pretty comprehensive. I mean, there's other good books, like Isabella Wentz has a great, has a few good books on Hashimoto's. Again, there's a number of, hers I would definitely recommend. But of course, I'm going to plug my own book and Hashimoto's Triggers. Like I talk, and I go into detail. I have a whole section where I talk about tests and list the blood tests and all the other, other tests. So I definitely would check that out. You have an entire month to get the book, even if, just get, I think it's like $6 on Kindle if you don't want to get the hard copy. But I think after you read that, and then maybe, one or two of Isabella Wentz's book, you'll be very prepared in February 28th. And also, I mean, there's a lot of free information on my website, naturalendocrinesolutions.com. And, you can take advantage of that, but I'd say just get my book, get Isabella Wentz's book, or, just get one. Even if you get Isabella Wentz's, like her initial book, that's still, really good. If you get my book, Hashimoto's Triggers, you'll be very prepared when it comes to going to the functional medicine practitioner. All right, I think I got to everybody at least once. So I'm going to quickly go back to YouTube and see if there are any, yeah, so Julius, I'll answer one more question, Julius, and then I'm going to get to Zoom, because there's a lot of people on Zoom who have repeat questions. So is there a connection between acid reflux and overactive thyroid? So, I mean, again, I deal with most of my patients, 80% of my patient base have, they have overactive thyroid. And I deal more with hyperthyroidism than Hashimoto, just because I'm one of the few doctors who focus on that. But yeah, I can't say that there's not a direct correlation, a direct connection between acid reflux and overactive thyroid. I will say H. pylori is a potential trigger of Graves, and in some cases that could be associated with acid reflux, but most cases, actually with H. pylori, a lot of people are asymptomatic. All right, and if I didn't answer a question, if just, actually it looks like Amanda. So Amanda, just came in with a question, so I haven't answered a question from you. If for any reason I have not answered a single question, I would say just copy and paste it again, put it in the chat, and I'll get to Amanda's here. And then again, if there's any new ones after that, I'll get to that. Then I'll spend, again, I'll go a few minutes over 3, but if I don't get to all questions, just keep in mind, Tuesday night, there's another call. And again, I'll probably do another before the challenge. I'll probably do at least another one of these. And again, there, for those at hyperthyroidism, definitely join the challenge and you'll get questions addressed there. But so Amanda's from UK, Yorkshire, and my TSH is low at 0.04, T4 and T3 just over halfway through the range. I take levothyroxine 75 micrograms in the morning, and and then 3 times 5 micrograms. So T3, like you're taking T3, 5 micrograms of T3 throughout the day periodically. Well, here, started T3, Thibun, Henning last April. Everything was wonderful for 8 months. Now my symptoms of hypothyroidism are returning. Any advice? So essentially, you're taking both T4 and T3, which had been controlling your hypothyroid symptoms. Been doing a real good job for 8 months, but now they're returning. So, and I assume those are your more recent labs, like TSH is low, T4 and T3 are so even though, so again, they're not showing that you're hypo. Obviously a TSH that's low is more hyper. And again, yeah, so your thyroid hormone levels are not, so you might be showing, so I mean, there's a few things. I mean, there are other things that could cause symptoms of hypothyroidism, not just thyroid, but thyroid hormone resistance. If someone has, like a normal or higher levels of thyroid hormone, and now usually with thyroid hormone resistance, so usually I have a higher TSH, but still check out my article, Thyroid Hormone Resistance, on my website. But I'm wondering if there's other things as well, other things going on, if the thyroid hormone levels are looking good, and that's why, I always, the goal is to try to, it's not easy to do, but try to find the triggers, the underlying imbalances, and I would say in your case, look into adrenals, test for adrenals, test for nutrient deficiencies. At least I would say start with those, like doing some, especially adrenals, if you have like problems with adrenals, that could, cause symptoms of hypothyroidism, as well. So, so that's where I would start. Again, I would look at nutrients as well. And, especially if thyroid panel is looking good. Now, of course, you could switch to a different type of thyroid hormone, but in your case, I don't know if that, like, you could try like desiccated thyroid, and maybe that would help, but, it can't always go by numbers. Sometimes, there are some people where the numbers look good and they just don't feel good on a certain type of thyroid hormone. But since you felt good for 8 months and your labs are looking good, I'm thinking it's not the thyroid hormone, that what you're taking is not the problem, that there's just something else going on. All right, so let's see, what questions did I not get to? I'll maybe go like 15 minutes or so maybe like 10 minutes after 3. And again, I don't think I'll get to, and this is a perfect reason why I don't like, I know there's, like it's nice when unmuting people, but when unmuting, the problem is usually, and I've done that in the past, and usually it turns into like a 5-minute Q&A session. And then, then there's like not a whole lot of time for, like, usually I won't get to everybody, I guess is my point. So, let's see. All right. So what exactly, so this is from Michael, what exactly does anti-TPO and thyroglobulin affect? So yeah, thyroid peroxidase is an enzyme. So that's what, and you know, it's important with the manufacturing of thyroid hormone. And thyroglobulin is a protein that's part of the thyroid gland, also plays a role in thyroid hormone production. So that's, you know, so when you have elevated thyroglobulin antibodies, that means the immune system is damaging thyroglobulin. And then with TPO, so TPO is an enzyme, so it's not just damaging the, you know, the enzyme, but it's the process of that enzyme, like the, you know, it's you know, again, it's the actual structure as well. And yeah, so it is the actual gland itself. It is, yeah, it's not, so like some will think, oh, it's just the enzyme. So, you know, if we get the, you know, but it's actually, it is still causing damage to the gland as well, not just that enzyme. And thyroglobulin, same thing. All right, so Layla, what are the exact names of the antibody labs to test if we have Hashimoto's or Graves? So for Graves, it's thyroid stimulating immunoglobulins. Now some will test, so TSI or thyroid stimulating immunoglobulins is a type of TSH receptor antibody. And so there are some labs or some doctors that won't test TSI, but they'll test TSH receptor antibody or TRAB, which that's okay too. TSI is just a little bit more specific. Thyroglobulin antibodies are more specific for Hashimoto's. Thyroid peroxidase antibodies also more strongly connected with Hashimoto's, but a lot of people with Graves have those as well. So, I mean, honestly, you know, if someone has Graves, definitely TSI. Maybe you might want to do TPO, and then you know, Hashimoto's, you're thinking thyroglobulin and thyroid peroxidase antibodies. But I will say, you know, with Graves, you could have, I guess with Hashimoto's, you could have all three too. But with Graves, sometimes I will see TSI, TPO, and thyroglobulin antibodies. So Marie says, should I take an antiviral supplement if I still have COVID antibodies at a level of 2,500 after 2 years of having COVID-19? I mean, I definitely would make sure you have healthy levels of vitamin D, and, you know, taking things like zinc and selenium and vitamin C, vitamin A, you know, maybe just like a good high potency multivitamin to make sure I mean, or you could take all, like if someone has active COVID, you definitely want to take separate like vitamin C and set, you know, you want like higher doses of these things. But you know, if someone's like in a more of a maintenance phase, and again, you know, arguably, are you in a maintenance phase if you have that level of 2,500? That's what I was saying earlier. I just don't know. It's not, you know, I don't know if COVID once, like again, if it stays in your cells and, you know, someone's going to have it long term. So, you know, like with Epstein-Barr, you know, I can't say everybody needs to take antiviral supplements, you know, even though most people have, you know, Epstein-Barr. So I would say no, like you wouldn't need to necessarily take antiviral supplements permanently, but you know, there are some supplements like Black Human has antiviral properties and actually has shown antiviral properties against COVID. And again, that seems pretty safe if someone wants to take that on a regular basis. You know, quercetin, quercetin also has antiviral. I don't know if I can't say everybody should take quercetin daily, but you know, there's like monolaurin. I mean, my answer would be no, that not everybody, like if someone had COVID 2 years ago and they still showing COVID antibodies, they don't necessarily need to take antiviral supplements. You know, you just want to do everything you can to, you know, you want to, again, the nutrients, you know, make sure you don't have nutrient deficiencies, make sure you have healthy adrenals, you know, you're getting sufficient sleep, you know, doing things to reduce your toxic load. So I would say do that. I would say don't, like, you know, just continuously, you know, take antiviral supplements, because the truth is we all have viruses inside of us. Again, most of us have Epstein-Barr, there's cytomegalovirus, and you know, COVID-19, maybe it's the same, where once you have it, you know, it's in your cells. I do think I've heard of people though, you know, I just recently got diagnosed with COVID, so I can't say, you know, in my experience, this is the case, but I thought I've had I've had maybe not patients, but just people where they tested positive for COVID and the antibodies, and then they did test negative like later on, like maybe like, a few months later, but I'm not 100% sure of that. Again, I know what Epstein-Barr now, and again, what there's IgM antibodies, IgG. IgM is like, for at least with Epstein-Barr, when you first get Epstein-Barr, IgM is positive, and then eventually those become negative, but the IgG, those remain positive for life. Again, for COVID, I'm not sure. I need to do research on that, because that is something that's important to know. Let's see. All right, so thank you for answering my question on going hypo from hyper. The doctor stopped methimazole and gave me the hypo medication. Okay, sounds like your doctor just panicked and didn't have a lot of experience with hyperthyroidism. I have had that before with someone's hyper. They're on the antithyroid medication, and then they become hypo, and then it's rare, but I've had doctors do that. There's also subacute thyroiditis where the person is hyper and then they kind of shift to hypo on their own. But okay, after 1 month on this medication, my T3 and T4 normalized. So on the hypothyroid medication, T3 and T4 normalized, but TSH is not normalized. So the doctor told me to stop the medication and test after 6 weeks. And now I'm waiting to test that. Yeah, I mean, I guess see what the test shows, but it sounds like you might need to see a different doctor. It sounds like the doctor kind of like panicked. All right. So what medication supplements interfere with thyroid lab tests? For example, B12. No, B12 doesn't interfere. Biotin interferes. So you want to avoid biotin for at least a few days if you're doing blood tests. That's the main one as far as blood tests. I mean, like there are ones that affect thyroid hormone, like if someone's taking levothyroxine, like you wouldn't want to take like calcium, like within a few hours of taking levothyroxine. But as far as, I don't know of any medications that affect the blood test. I know when you like visit LabCorp or maybe even Quest Diagnostics and you look at the thyroid panel and antibody, and I think antibodies too, it'll say specifically biotin. So I don't think it says anything else. And again, I'm not 100% sure that there's no other supplements or medications that interfere with the thyroid lab test, but again, biotin is the one that's the main one, at least again, red flag by the labs. Also keep in mind exercise. You want to be cautious with exercise and blood tests. Like I wouldn't exercise the morning of doing blood tests because those could throw off the blood test. All right, Veronica, let's see. So I forgot your question initially because you have a follow-up. Okay, so TSI and TPO were negative. All right, so where's your question? Where's your follow-up question here? Okay, so TPO is negative. At the time of diagnosis, T3 and T4 were only slightly elevated, but TSH was 0.05. Now TSH is 40, but T3 and T4 are low, yeah, which makes sense. They're not very low, but below the range. Yeah, that's that. Yeah, and again, that's you are on such a high dose, like the 40 milligrams. So. All right, and thank you, Walt said, thank you very much for addressing my questions. I'm very appreciative. Your publications are very informative. Well, thank you. Thanks. Yeah, definitely for those, again, if my podcast with the naturalenergiesolutions.com, I really haven't written, I did write a few diet related articles last year, like ketogenic and carnivore diet. I've just had a hard time keeping up. And honestly, I've just prioritized the podcast just because Google, just really in the past I would write articles and they would do real well in search engines, but Google is like penalizing the natural healthcare sites. So so really haven't spent as much time, just because there's, the only one, most of the people that see my articles are my current followers. There's not a lot of new people that find the articles because Google like buries it. So I just haven't spent a lot of time like I do. What I do is with the podcast episodes, I have them transcribed, and then I use those as blog posts on my Natural Endocrine Solutions site. Let's see. So Corey with the second question, I hold my breath while sleeping. Yeah, maybe sleep apnea, I would agree. Could this be related to Graves' disease? My breathing is also somewhat shallow throughout the day while I'm sleeping when I'm not holding my breath. I mean, shallow breathing throughout the day, that could be related to hyperthyroidism, associated with Graves. As far as holding breath while sleeping, I don't know. I don't think, again, I haven't really had I've been working with hyperthyroid patients for over 10 years now, and that's not one of the, whenever I see patients, I have them fill out a comprehensive health history. And again, that's not something that comes up frequently as far as holding breath while sleeping. So my guess, it probably is not related. I'm not 100% sure, but I definitely would look into the sleep apnea. Okay, so I will be working with you in April. What blood work should I have for you for hypothyroidism? Contact Kate. If you're actually working with me, you probably, I don't know if you spoke with Kate, my staff person, Kate, but you could email her, staff at naturalendocrinesolutions.com. Again, it's in my book too, Hashimoto's Triggers, but but again, if you're planning on working with me, you could email her and she'll let you know. All right, so Brenda, does elevated TPO antibodies automatically mean Hashimoto's? If your TPO antibodies go back into normal range, would that be Hashimoto's in remission? Thank you. So TPO antibodies, you could have those with Hashimoto's or Graves. Like I said, it's more closely associated with Hashimoto's. If someone has Hashimoto's and TPO antibodies are positive and thyroglobulin antibodies are negative, and then those TPO antibodies go back in range, then yeah, I would consider that to be remission. I mean, when someone's in remission, I want to see those antibodies normalized. Not always easy to do, but that's what I'd like to see. But I would also, if you haven't tested the thyroglobulin antibodies, I would do that because those could be positive with Hashimoto's. And if TPO, and it is possible for one antibody to be negative, like to get within range, but the other one to not be in range. And reason is you could have different triggers for different autoantibodies. All right, so prolonged Pauline S, prolonged use of levothyroxine 5+ years causes what possible other issues, symptoms? I mean, if you're carefully monitoring the thyroid hormone levels and everything looks good, it's really, I mean, it shouldn't cause any problems taking the levothyroxine. I mean, I'm not a big fan of synthetic T4. I mean, but again, I mean, people have been on that for years, and the big thing is if you take in too much, it can cause lower bone density. But as far as like, causing, other like harmful effects, I mean, anti-thyroid medication, when it comes to hyperthyroidism, that's a completely different story. But as far as, for hypothyroidism, levothyroxine, it does seem to be fairly safe. Again, just I would monitor your blood test on a regular basis. All right, we got a couple of actually new questions. Like people who didn't ask until now. Let me see. All right, and no new on. I don't think we have new ones on YouTube. So what I am going to do is I'm going to answer these two questions, and then I'm going to call it a day. There's more than two questions, but the other ones are repeat questions. So let me bring up the chat again. So Magdalena and D are going to be the last two questions, and then again I'll be back on Tuesday evening. So Magdalena, hi Dr. Eric, I have Graves and currently on microdoses of methimazole for a year now. I believe my trigger is stress. What can I do to support myself and how to overcome stress? I remember you mentioned heart math. what product you had. Would you recommend any supplements too? I mean, yeah, so I use Inner Balance. Like if you visit HeartMath I forget if it's .org or .com, but Inner Balance. But you know, you could do meditation, you could do yoga. I mean, you don't have to use HeartMath, which is heart rate variability. And again, if anybody's interested in learning more, I would just visit the website. And yeah, so stress management, getting proper sleep are the two biggest things I would recommend. And you know, as far as supplements, I would just make sure that you're, you know, I definitely want to eat well. You know, prioritize eating well, and you know, making sure, you know, no nutrient deficiencies. But I mean, you know, if someone wants to take you know, I guess some adrenal support like holy basil, like for example, you know, but again, I wouldn't say, I would focus more on the stress management, the mind body medicine. And then, you know, what I would also say is do an adrenal saliva pat. When it comes to supplements, I don't like to blindly recommend supplements. I like to test. And when I dealt with Graves, I did an adrenal saliva test. So I would say do an adrenal saliva test, or again, dried urine testing like Dutch testing. And then, I mean, ideally, based on the numbers you want to, you know, ideally work with someone to see what you would need to take based on, you know, those patterns, you know, what pattern you have on the adrenals. All right, so D says, hi all, I've had Graves for years and managed with methimazole, currently taking 5 milligrams per day. My labs in September were TSH 1.58, free T3 2.6. So again, thyroid not looking too bad, TSH looking good, free T3 maybe a little bit less than optimal, but within the lab range. But TPO is greater than 13,000, and now one eye is bulged and the other is exactly the opposite, half closed. I feel pretty good though, the best I've ever felt. I just did 6 courses of O3 UV treatments at my chiropractors and will now get my labs done again. Hopefully my TPO has lowered. Will my eyes eventually settle down, have a little double vision? It depends on the severity of thyroid eye disease. You know, like definitely there's hope and there's help for thyroid eye disease. Again, I put in the chat one of my episode, I think it was 8 on my podcast. And again, this coming Tuesday, check out the interview with Dr. Ronnie Bannock. But if it is more severe, sometimes conventional treatment could be necessary. There is something new called Tepezza, which again, I'm not recommending to most people, and it is outrageously expensive if someone doesn't have insurance, but it is another option, which again, I think I spoke about on when I did my episode, you know, the solo episode, but we also will chat, Dr. Bannock will chat a little bit about that on the episode on Tuesday. So, you know, there is that if you have to, but definitely I would, you know, do things to, you know, from a diet perspective, you know, I know, you know, she spoke about specifically nightshades, and, you know, I've spoken about autoimmune paleo and just doing things to lower stress. And again, she speaks about supplements. I also discuss certain supplements, you know, so again, check out the podcast episodes, and also website, naturalendocrinesolutions.com. Do a search for thyroid eye disease. I do have some articles on that. But yeah, I can't promise that your eyes will get 100% because it does depend on the person. So I can't say they promise that they'll get back to where they were, but it is possible. And, you know, it depends on the person, depends on the severity, but definitely check out my podcast episode, or episodes. Again, the one that already has been released and the one that's coming out on Tuesday. And then again, my articles. And all right, so I am going to again call it a day, but I appreciate everybody showing up and asking questions. And hopefully, I think I got to everybody at least one time. That was my goal, and I know I got to a number of people multiple times. And again, so I will be live again on Tuesday night, same link. Tuesday at, I think it's 8:30. It's either 8 or 8:30, but I'm pretty sure it's 8:30 on Tuesday night. And then, like I said, I'll probably do another one of these. I'm not sure when, but it'll probably be before the Hyperthyroid Healing Challenge. But if you have hyperthyroidism, definitely August 14th, look out for the email with the registration information. If you have Hashimoto's, hypothyroidism, Hashimoto's, I will be doing an event in April or April or May that will also benefit those with Hashimoto's or non-autoimmune hypothyroidism. So be on the lookout for that. But definitely, again, hyperthyroidism. Be be on the lookout for the registration information. And again, everyone have a wonderful Saturday, a wonderful weekend, and maybe I'll catch some of you on Tuesday night. And if not, hopefully some of you during the challenge. And if not, on the podcast. All right, take care, everybody. Again, have a great weekend.